Acne is a disease caused by the blockage of the pore, the sweat pore. So there are different types of acne. So if you are suffering from acne, I think this video is for you. We have 7 different types of acne. We have whitehead, we have blackhead, we have purples, we have nodules, we have pustules, we have cysts, we have acne conglobata. Those are the 7 types of acne. When I say nodule, I don't mean indole. So I know people are usually popular with the whitehead and the blackhead acne. The truth of the thing is this: you cannot treat any infection, any disease without knowing the cause of it. You understand? I've seen many videos about acne, different products. Fine, they are wonderful videos, but you have to know the cause of a thing before you would know the treatment. You understand? Whitehead acne, and you also have to know if this type of acne, is it the one that requires these drugs, or is it the one that requires squeezing? They actually, you hear some people saying, don't touch the acne. If you touch it to get worsen, if you squeeze it to get worsen. But actually there are acnes that you need to squeeze out for you to treat them. That's just it. For example, the whitehead, the pore is blocked, and the length of the pore, that's the body of the pore, is also blocked. That's why it is called whitehead. And that the whitehead acne does not require squeezing. You cannot squeeze whitehead acne because the pore is closed, everything is blocked. So if you want to squeeze it, you will be making it worse and it will be spreading. But the blackhead acne, you actually need to squeeze it out so that it would go. But it is not advisable to squeeze. Why? Because you might, create scars on your face. But if you can do it very well, or you have somebody that can help you do it in a way that it would not create scar, why not? It will even help it to go faster. Then we also have the purpose acne. Those ones also are caused by oil. Majorly all acne are caused by the blockage of the pore gland, where your sweat goes out. Sweat, they are S products of the body. So but when they are blocked, there are many factors that could make the pore to be blocked. It could be that, I remember there was a time I did a very tight hair, and when I did that tight hair, it was so tight that even me, I was even feeling it. So such a thing could make your gland to secrete more oils on your face region, secrete more oil, and when that oil on your face gets contaminated, you could be infected with acne. So now, other things that could also, there are also bacterial infection, even without maybe having excessive oils, and also hormones, like if you are taking some androgens, and even some ladies also take drugs that makes their skin to shine and all that, and those drugs also contains androgen. Androgen is a male hormone, but it's found in a very little quantity in female body, but it helps the skin to glow. So if you are now using it, glow, and so it synthesized oil, it spills off the formation of oil in your body, so you see the skin shining. So when there is excessive oil in your body, you see that this acne is inevitable. So we'll be talking about the treatment of acne and what are the things. I already mentioned that if you have blackhead, that you are free to squeeze it out. Then you also have another type of acne that also requires squeezing out, but this one is majorly you contact it majorly by bacterial infection, which is the pustule. The pustule is by bacterial infection, and if it blocks, the pore will spread to other surrounding and infect you. But you need to bring it out. So that pus actually needs to be removed. The acne conglobata is mainly caused by hormonal changes and drugs, especially those people that they are treating infertility. So that one could cause. And it's a combination of nodular acne and pustular acne. So it's just a combination. I said earlier that those 7 are the basic acne, but that you can have a mixture of blackhead, whitehead. Like this conglobata is a mixture of nodules acne and cystic acne. So it's very severe. So now let me share my testimony of how I conquered it. You can see my pictures there and all that. So when I had this, I made this very tight hair, like I was about telling you earlier. I noticed that I was having pimple and all that. I actually, at first, I didn't even know that it was the hair. I felt maybe it's because of the cream that I was using. So I stopped applying the cream on my face. I started using it only on my body, and but yet this thing was keep on spreading all over my face. And me, like, pardon me to use the word obsessed. I'm obsessed with my face. I like touching my face every time. So when someone tells me that this acne, you don't need to touch it to this one, so don't touch it. If you touch it, spread. I know that would be difficult for me to do. So I was very, very like concerned that I needed something that would clear it faster. So I went to a pharmacy. That when I got there, I met the pharmacist. I said I needed a drug. That I actually saw the name of a drug anyway from somebody, from a doctor. So from a doctor friend. So I took the name of the drug. The doctor friend gave me that drug that I should go and buy. So I'm not going to say the name of the drug, okay? So that I should go and buy the drug. So when I got to pharmacy checked the drug. I'm like, okay, that it's the drug is actually birth control pill. That was what he said. There's a birth control. I was like, birth control pill, okay. I said, okay. Immediately he told me that it's a birth control pill. I said, okay, tell me what are the side effects? Because fine, I will not say because I want to treat for acne, I will not go and have something else. So now checked. Actually, I was there with him, so I checked the side effect and also that it could even affect my hair. Hair that's me I managed before. I said no, I don't want anything that would affect my hair, that my hair would not start pulling off or something like that. No, I don't want anything. And I told him that what else should I? He said that maybe I should leave it, that it will go with. I said which time? How many? He said no, me I don't have time for that. So that was why. And now you know what I did. I searched now so that there are different things that could be used to treat acne. Sulfosalicylic acid, benzoyl peroxide, retinoid, which is derivative of a vitamin A. So me and I said, okay, I will go and look for something that has vitamin A I'm using. So and I got this. I hope you know this. Nano extra right. It contains vitamin A. So I was not. What I actually did was, let me tell you. Before I actually did that, let me tell you. I went to do a urine test. I know that it might not really be part of it, but I did a urine test. I just want to tell you the summary of everything that I did because I don't really know if it was this one. So after I did it, I had staph, so I treated it. They actually gave me a drug, Cipro. So I treated it. Then when I got this, the acne was still there even after taking the antibiotics. So I got this. So I was now applying it on my face. I will apply it on my face and I will leave it for 5 minutes before I will take my bath. That was what I was doing, and I noticed a very reasonable. It was effective. When I was using it, it was very effective. I started using it and it was clear. I would 5 minutes on my face. Anytime I want to bathe, I bathe. If I'm at home, I bathe 3 times. I'm not at home, I bathe 2 times a day. So anytime I'm bathing, I use it. And that was why I noticed that it started clearing. Though I was still busting it, I was squeezing it though. I didn't leave it like that because mine was not white head. It's a blackhead. It was not white head acne. So I was busting it. So antibiotics, vitamin A treats acne, any kind of acne. Though even though I said that cystic acne is more severe, that conglobata acne is more severe. Conglobata acne, that one you just even what the doctor just needs to control your hormone, and maybe if the drugs they are giving you for infertility, they can stop it if the case may be. But for the cystic acne, bacterial infection, you need antibiotics to just treat it. But if it's a white head, don't touch. If it's a black head, squeeze it. Look for something that will help you squeeze it in a way that it would not affect any of parts of your face. So you see the content of this soap. It contains vitamin A. If you can see it, it contains vitamin A, vitamin C, papaya, carrot derivatives, and all that. But why I was even using I was only interested in the vitamin A content, which would help me clear the acne. Though it's not like it works like magic. Maybe you use it today, the next day. Actually, no, it's actually cleared my face. I actually used it for like 4 months. 4 months. Remember, I said anytime I'm taking my bath, I use it on my face. I apply it on my face and leave it for 5 minutes before I take my bath. So I use it for 4 months. Everything cleared. So if you even see my face, you won't even know that I have acne before. Now I'm not even putting on powder or anything. So that was what I used. But now I'm no longer using it too. Let me be sincere. It's not as if it's not good. It's still good. But I'm this kind of person like trying things out. So I'm no longer I'm not using this one. But this one, let me even see what it contains too. It's also papaya. It's also pawpaw. It contains pawpaw too. And does it even have vitamin A? It has vitamin A too. Wow. It has vitamin A too and vitamin C. This one is a idle soap. It has vitamin A and vitamin C. So it's not as if this one, but I'm just trying that. So what I'm trying to tell you is that if just know the cause of the acne. If your hair is tight, your hair follicle is very tight, losing it. Don't say you want to do again and go and kill yourself. Losing it. Then if it is cream that you notice that you have been applying the cream, is the cream that is going to stop the cream. Stop applying that cream majorly. And if it is white hair, white head acne, don't post it. But if it is blackhead, post it. And if it is postule, all you just need is remove the yellow, but look for somebody that will help you to do it, to remove that yellow pus that is inside, and make sure it does not touch somewhere else, because if it touches it, it will start spreading just like that. So that is actually the thing. So vitamin A, you apply it on your face, then you leave it for some time. Or if you cannot get access to this, just go and buy this soap, apply it on your face for 5 minutes and be using it. I did not tell you that it was my own for 4 months. That was why I was applying it for 4 months. So I didn't tell you that it works like magic or this thing. It's for 4 months. I was applying it on my face, leave it for 5 minutes. No matter how if it did not work, come back to this thing. If you after doing all this thing, you're losing your hair, you notice that you have a bacterial infection and you treat it, then you use this one and your acne did not clear. When I mean clear, I mean even the spots too clear. Come back to this video and tell me that it does not clear. Let me know let me know why. Let me know. It means you are not doing the right thing. So and another thing I want to also state that don't be using towel on your face when you know that you already know you have acne. You're using, or you already know you even have acne. You are using oily soap. Well done, no, anti-fine. You're using oily soap and you know you have acne. You are using oil cream. You know your cream is oily. You're still applying it. You want to kill yourself, and tomorrow you now come and tell me that it did not work. And you know that your cream that you're using is oily, and you're still applying it, and you're using this one. You want it to work, and fear God. So what you need to do is that cream, stop applying it to your face. Be using it to your body. That hair that is tight, lose it. Cooking shogun. What is it? And what is it, safe that you watch this video, you not subscribe? What is it? Are we quarreling? You not subscribe, you not like, you not share, you not do anything. What is it? Oh girl.